Hello, everyone, and welcome back to Navigating the Periphery. My name is Debra, and this is my son, Philip.
Hello.
How is everyone doing today? If you're into what... Haha, fooled you. How is everyone doing today? If you're into what we're doing on this channel, you know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we're trying to stop the stigma of a mental health diagnosis, one show at a time. It's a little warm in here today. If you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You guys out there are not alone. We're here.
So, Philip, same old question. How are you doing today?
Doing great today, Mom. How about you?
I am good and excited to discuss today's topic.
Please read the disclosure at the end of our episode. We are not medical professionals. Our channel is for information and education purposes only. And I'm speaking to you guys out there from my personal life experience with OCD, GAD, and schizoaffective disorder. So please refer to our full disclaimer at the end of this video in every episode that we put out. Today, we are going to navigate the periphery of how current events happening worldwide are affecting mental health and give some information and sources to try to help.
Okay, breathe. Several recent events and developments are shaping the conversation around mental illness in 2024. And age is not a factor. Whether it's the upcoming presidential election here in the United States, the Israel-Hamas war, the war in the Ukraine, the economy, online bullying, school violence, or just the uptick in violence in general. People young and old are stressed out, and anxiety over these situations is affecting many. A recent survey from the American Psychiatric Association highlighted rising anxiety among U.S. adults. In 2024, 43% of adults reported feeling more anxious than the previous year, driven by the concerns about the economy, elections, gun violence, and safety. Despite this increase in anxiety, many are not seeking professional help, with only 24% consulting a mental health professional in the past year. Issues like stress, sleep problems, and social disconnection, particularly among younger adults, are seen as major contributing factors.
As many of you guys out there already know, September is recognized as Suicide Prevention Month, with organizations like the U.S. Department of Health and Human Services, or HHS, and the Substance Abuse and Mental Health Science Administration, or SAMHSA, ramping up efforts to address rising suicide rates. New strategies are being developed, such as the 2024 National Strategy for Suicide Prevention, alongside public awareness campaigns like the 988 Suicide and Crisis Lifeline. An overwhelming majority of people in the United States think the country is experiencing a mental health crisis. According to a new survey from CNN, in partnership with the Kaiser Family Foundation, 9 out of 10 adults said they believed that there's a mental health crisis in the U.S. today. When asked to rate the severity of some specific mental health concerns, Americans put the opioid epidemic near the top, with more than 2/3 of people identifying it as a crisis rather than merely a problem. More than half identified mental health issues among children and teenagers as a crisis as well as a rise in severe mental illness in adults.
Mental health providers throughout the country share a sense of urgency to find new ways to meet the high demand for services, and many in the field are exploring interventions that diverge from traditional therapy models. The creative approaches include forms of support that require less time commitment from individuals, can be offered through digital devices, or both. Clinicians and researchers are seeing the benefits of these strategies in settings such as community clinics and college campuses, where psychologists experience a duty to serve and patients are open to exploring new options to access help. So here is some great information and some great apps and websites to help if you're interested in virtual help.
Yes. If you cannot actually see a physician or a therapist in person, or there's an issue with one being available to you, and you want to talk to a psychiatrist, there is Talkiatry.com. If you would like to speak with a psychologist or therapist, there is Talkspace.com and BetterHelp.com. If you are interested, you can Google best online therapy sites to find more that are available. We will leave links to all 3 sites in the description box below. If you are looking for just basic information on certain mental health topics, there are 2 sites on YouTube we really like. These are the channels we went to during the pandemic when I was having issues. One is Psych2Go, and the other is PsychHub. I'll leave the links to those below as well.
That is really great information, Philip.
Thank you.
What we are really trying to stress in this week's episode is many people are suffering, but there is help out there and information is available. Expanding access to mental health care is essential. Individuals should be encouraged to seek therapy or counseling when needed. Programs like teletherapy have made it easier to connect with professionals, although many people still prefer in-person care. Making mental health services more affordable and accessible, especially through insurance, is going to be a key factor in reducing the gap in mental health care.
Reducing stigma through talking openly about mental health is critical. Talking about mental health with friends, family, and in workplaces can help normalize it and encourage individuals to seek help. The decreasing stigma around mental illness in the United States is a positive sign. But more work is needed.
Definitely.
Especially in communities that still face barriers to discuss mental health.
Community-based initiatives like support groups, peer counseling, and local mental health resources are vital, particularly for those at risk, and participating in local mental health advocacy events helps create a support network for at-risk individuals. Many schools here in New York, especially kindergarten through 12th grade, usually have multiple school psychologists on staff to help students navigate stressful situations, whether it's in school or at home.
Reducing stigma through open conversations about mental health is critical. And just remember, it's okay not to feel or be okay all the time. You guys out there are not alone. We are here.
And as always, thank you so much for joining us today. Navigating the periphery, we are always here trying to stop the stigma of a mental health diagnosis, one show at a time. So until we see you again in our next episode, please utilize all this good information, and we'll see you in another episode coming really, really soon. Take care, and bye for now.
Bye.
Bye.